Hello, everyone, and welcome. Thank you all very much indeed for joining this exclusive event on mental health. I'm Richard Hawkes. I'm the Chief Executive of the British Asian Trust, and I'm absolutely delighted that so many of you are with us today. I just regret so much that we're not doing this event in Karachi, but hopefully it won't be long before I'm able to travel there again and we can pick up our program of events in Pakistan. Mental health is a huge priority for the British Asian Trust, and our mental health program in Pakistan is one of our most successful programs. We've been so fortunate to have worked in partnership with the CareTech Foundation and the COSARAF Foundation on this program. And I'm absolutely delighted that my great friend Haroon Sheikh is one of our panelists today. I'm also delighted that another really good friend of the British Asian Trust, Nithavrianakis, is the Deputy British High Commissioner to Pakistan, is also on our panel today. We've been so fortunate with the support we've received from Mike and his colleagues, and this has helped the profile of our mental health programme and the general work of the British Asian Trust absolutely enormously. I won't mention the other panellists, as that is really the job of our host today, the brilliant Asad Ahmad. Those of you in the UK will know Asad from BBC television. Asad's been such a great ambassador and supporter of the British Asian Trust for many years, and he's been especially supportive of our mental health programme. Before I hand over to Asad, let me just highlight that this coming Saturday, the 10th of October, is World Mental Health Day. World Mental Health Day gives people across the globe an opportunity to have conversations which really should be happening on a daily basis. And it also gives us an opportunity to come together and raise our voice. This year's theme is about encouraging more people and more organisations to invest in mental health. This is exactly what we at the British Asian Trust are trying to achieve, to support more people by making our mental health programme even bigger and encouraging others to follow the great example of CareTech and invest in mental health and in mental health programmes. That's enough from me. I'm sure we're going to have a fascinating discussion with this excellent panel that I'm delighted we've been able to put together for this event. And it now gives me great pleasure to hand over to our host, Asad Ahmad.
Richard, thank you very much for that introduction. It's an honour, as you know, to be an ambassador for me for the British Asian Trust. And in that role, I have actually travelled with the Trust out to Pakistan to see for myself the issues faced around mental health there and the impact on people's lives. I saw the impact also of the British Asian Trust working with partner charities out in Pakistan and seeing for myself the incredible help it gives not just the people with mental health issues, but also their families and in turn their communities as well. So it's my pleasure to be here to moderate this session and webinar today. So thank you for allowing me to do that. We have a great broad panel of speakers with us to speak to, and there's also a chance for you to put questions to them later on. The chat box at the bottom of your screen is there for that purpose. Just click on it, and as the speakers speak, you might have a question that you want to put to them. Do type out your question, let us know where that question is coming from, and what I'll do my best to get through as many questions as we can a little bit later on. So let's meet the panel now. First of all, we have Dr. Murad Khan from the Aga Khan University in Karachi, who's also the president of the International Association for Suicide Prevention. We're very glad he's joined us, and he's actually joining us from Edinburgh today. He's gone there on business, and he's kind of stuck there as well because of COVID, but what a beautiful city to be stuck in, Dr. Khan. Thank you for joining us today. We also have the British Deputy High Commissioner in Karachi, Mike Nithavrianakis, who's a big supporter of the work that the British Asian Trust does, not just personally, but also through the High Commission as well. Very grateful for your time this afternoon, sir. We have Mr. Haroon Sheikh, the Chief Executive of CareTech, who you heard Richard mention earlier, a leading social care provider here in the UK. However, he's also the chair of the CareTech Foundation and COSARAF Foundation, which do tremendous charitable work both here and in the UK and also abroad too. We have with us Ms. Fathema Zubair, the Director of Human Resources for Unilever in Pakistan. It's a huge employer, not just in Pakistan, but also all around the world as well. A huge company it is. Thank you for being with us this afternoon. We have Sanaa, the Mental Health Manager at the British Asian Trust. She's been leading the Trust's mental health program in Pakistan for a couple of years now. Thank you all panelists for giving us your time here this afternoon. Really looking forward to this discussion we're going to have. Dr. Khan, President of the International Association for Suicide Prevention. If I could start with you, sir, and you know so much about the issue of mental health in Pakistan, the negative impact it has on so many lives. You must be very glad that we're having this discussion today, very glad of the many discussions taking place around mental health these days anyway. It must be really positive. I'm wondering, is it all positive? Is it all good news?
Thank you, Asad. Great question, and thank you for British Asian Trust for organizing this and inviting me. Yes, I think it's great that there's so much discussion and talk around mental health due to the pandemic. But you know, the American philosopher George Santayana said that those who do not remember the past are condemned to repeat it. This is not the first major catastrophe that has befallen us. Obviously, this is at a larger scale. It's global, and it is also something that is ongoing as opposed to the other catastrophes. The earthquake in Pakistan, the flood, the terrorist attack, and so on. These were the kind of the major events that led to mental health response in Pakistan. But for a few days, there was a lot of talk around mental health issues when these events happened, but then nothing really came out of it. No sustainable programs were developed, although there was a lot of issues and talk that we will be setting up, different programs. So yes, it is very good that we're talking about it. We're talking about it at a much larger scale. And because the pandemic is ongoing, the talk around mental health is also continuing. My fear is that if history is anything to go by, once we come out of this, a vaccine is developed or the virus dies out, I think we might go back to business as usual. And I would very much hope that this gives us an opportunity to come together as we are doing today to develop, not just develop, but really think through and discuss how can we develop programs through the mental health that has been highlighted that can really be sustained in the long term. So yes, a lot of positives, but also we have to be cautious that we don't let the opportunity go away without something being built up for the long term.
Dr. Khan, you say about establishing programs to help the issue of mental health at this time, and looking at Pakistan in particular. And I know this is a big question. I'm just going to ask for a short answer, if I may. What kind of programs do you think are going to have the desired effect that needs to be done there?
Okay, so I think it's very important to be realistic about this. We talk about mental health, but we cannot talk about mental health in a vacuum. The development of mental health system or a program in a country is inherently linked to the development of society and the development of the health system in that society. A health system itself is very weak. So you can't just talk on mental health without really looking at the bigger picture of the health system. So what we can do now is to really position ourselves, look at what kind of programs would be relevant, which should be affordable, which should be accessible, should be culturally relevant, and should be of quality, so that once the health system in Pakistan improves, that we are in a position then to integrate mental health into the wider health system.
Dr. Khan, thank you for now. Anyway, that was a very interesting answers. Deputy High Commissioner Mike Nithavrianakis, if I could turn to you now, sir. And I know both you personally, like I said before, as well as the High Commission, have been working hard with the British Asian Trust in order to tackle this issue of mental health. What I'm wondering, sir, is why is the British government so interested in helping on this huge global issue, as Dr. Khan said earlier, in countries away from Britain? What's in it for Britain?
So thank you very much, first of all, for the opportunity to participate. I'm really honoured to be part of the panel. I would say that because mental health is such a big challenge for the United Kingdom, we recognise that the COVID-19 pandemic has probably only made those challenges more serious and more urgent. And I think as a country, we've got a tradition of being quite keen and open and transparent and wanting to share our successes, but also share some of the failures. And I think everybody recognises that in the UK, we may underestimate the health crisis that exists around mental health. And as somebody who is a foreign diplomat, honoured to be representing his country in Pakistan, I can see some of those challenges even in a very diverse city like Karachi. I think we can all work out that the problems of domestic abuse, child exploitation, even things like loneliness that exist in both countries are things that we need to share our experiences on to be able to work out some of the solutions. And I think talking is a very, very good way of doing that. But we also need to come up with practical systems and policies and structures. And I think particularly in a country like Pakistan, where there is an extraordinary tradition of philanthropic giving, to be able to help those more in need than many individuals, where the health system might not be able to reach all of that unmet need. I think there is a way where we can bring our two communities together to hopefully address some of those challenges. So it's a really important area. Of course, it's an important area when there are huge health impacts as a result of COVID-19 and other things in Pakistan like malnutrition. So finding the right space for mental health to be discussed in a country like Pakistan, where there is still a stigma attached to talking openly about it, and maybe some cultural challenges about doing so, is something I think that is difficult. But remember, we have about 1.5 million British nationals of Pakistani origin who have a huge amount of experience that they can share and are already doing a lot in healthcare and education, and mental health could just be one additional aspect that they could support, I think.
And it's great to hear, Deputy High Commissioner, that Britain is taking such a leading role when it comes to mental health in Pakistan. What I'm wondering, sir, if you know the answer to this, are other countries following suit, or is there room for other countries to follow the example of Britain? I
think there's room for many other countries. I suspect there are other countries in Pakistan who are doing good things, partners of ours who have development programs and are very focused on healthcare and education. I think the need is so great, there is room for lots of countries, and there's a very well-established way of us coordinating that sort of activity. So there's the formal nature, obviously, of doing development type programs, but I think mental health gives us the opportunity, I'm afraid to say, because there is such a dearth of trained professionals, and I imagine many of Pakistan's top professionals are probably on this call, but it gives you a sense of how small a cadre of expertise exists, that we need to broaden that out as much as possible. So the work of organisations like British Asian Trust and CareTech, other NGOs, other interested volunteers is really valuable, and bringing that together in a holistic way that can develop, where we sort of punch above our weight and we're more than the kind of individual parts, I think is something that the UK would be very keen to try and assist with.
Yeah, and you mentioned CareTech there. Let's turn to CareTech, because we're lucky to have the chair of CareTech, Mr. Haroon, Sheikh, with us this afternoon. Thank you for joining us, sir. Your charities have been supporting mental health issues and the British Asian Trust and the work they've been doing for a few years now. Before, dare I say, mental health came onto our radar in the big way it has done over maybe the last 12 to 18 months. You were there first. And I'm wondering why, Mr. Sheikh, you took such an interest so early on in this issue of mental health. What was it that drew you to it? Why did you think it was so important that your charitable trusts need to start tackling this?
Thank you, Asad. Also like to reach out to British Asian Trust for kindly hosting this webinar, because really anything we can do to promote mental health awareness across the country, across the world, will be helpful in doing more in this field of mental health. CareTech, if I may, just by sort of people, to put it into context, why we got involved, I suppose, is CareTech as a company is a listed group, has been around for 27 years, is a leading UK player in the market of mental health services, specialized care, learning disability for adults and children. And when we set up the foundation, which is, I think, 3 years into making now, we wanted to do more of the good work that the CareTech the business does through the work of the foundation on a charitable basis. And we were looking for a project where our family charity, who works very closely with the CareTech Foundation, in fact, were one of the founding members of the CareTech Foundation, COSARAF. We wanted to look at a worthy project that would be befitting of the work that we want to do, the change we want to bring, and how we want to reach out to people that need help. And mental health was on the agenda with British Asian Trust. Richard spoke to us. We liked what we saw. We went to our board. I was lucky enough, I still am a chair of the foundation and COSARAF, and I was able to talk to my trustees, and they were all very supportive of this program. And we embarked on the mental health program for Pakistan because really Pakistan was close to our heart because one, it fitted with the British Asian strategy for working in South Asia. And secondly, we have our roots in Pakistan. And I think certainly our parents were born in Pakistan. So I was delighted when British Asian Trust said, look, there's a project, and we've done a lot in 3 years that we've been there, but there's a lot to do, Asad. And one of the things we are finding on the ground is that finding the right partner, which British Asian Trust helped us find, was very important. And the delivery was important. And, 1 in 4 individuals in Pakistan have a mental health issue. When you consider the population of Pakistan, that makes it around 50 million people in Pakistan have got some kind of underlying mental health issues. And these are small things we take for granted. It could be stress, it could be anxiety, but those things are left alone can be quite, they can cause problems. They cause more issues really. And I think we've seen in Pakistan, suicide rates have gone up. There are many issues in the healthcare sector that this program, I hope, has been able to help people with the work that's happening on the ground really. So that's why we got involved. We were passionate about delivering care because that's what we do in the UK. We wanted to do more outside of UK. And this project with the foundation and the work of the British Asian Trust was very important. And so that's why we got involved with it.
Well, Mr. Sheikh, I know I've seen some of the work that you've done out in Pakistan, and it is terrific, the impact it has made to help people in so many areas of Pakistan. But Mr. Sheikh, I know you won't mind me saying this, but as well as the work of your charities, you are first and foremost a very successful businessman. And so you will understand my next question better than anyone, that as a businessman, what is the incentive to invest in the mental health of your employees, of people in your society, in your community? What's in it for businesses to take a more active role and put money there?
Our business and I think setting up the foundation was all about putting back into society what we actually gain from a society and a community. Corporate social responsibility was top of our agenda at CareTech. And the foundation, actually, when we set up the foundation, it gave us the ability to do the work in terms of reaching out to those that needed help, whether they were individuals, whether they were organizations. Yes, Asad, we do a lot of charity work. This was special for us because we wanted a high degree of governance, because with the PLC, with the brand and with the following, we wanted governance, we wanted transparency, and we wanted accountability. And having the British Asian Trust alongside as partners was important to us, because the feedback, one is you embark on a project, two, using your entrepreneurial hat, and you said, what's the benefit? What's the touch and feel? What can I see? What's the numbers I'm going to reach out to? We then commissioned a report. It was an impact report, which also I know British Asian Trust also did. And we were delighted with the scale of masses of people we were able to reach through the use of telecare and technology. Because really this was a very unique structure of setting up clinics remotely, very quickly, using technology rather than having to build buildings. And within those, using technology, we were able to reach out to people and we were able to do consultations with them. The other thing around the commercial part is because you want to make every charity has a desire to do more. And every pound you give, you want to do more with that pound. So we said to the British Asian Trust, if we put in £1, we want you to match fund it. we said that to our family charity and say, if you put £1, we'll also match fund it. So £1 became £3 to £5 very quickly. And we were able to embark on this £1 million project with lots of momentum behind it. And, you know, everybody's played their part. This is a team effort. You know, Richard only did recently, a couple of weeks ago, swim in the cold waters of Heathrow Lake to raise money. I think this is all about commitment. And I think we can see that the outcomes through the report is there. But I have to say, sir, there's more to do. We can't stop where we are. We need other credible organizations, please, working with us. And part of today, I'd be pleased if we can hear from other organizations. I know we've got Unilever on the panel as well, to join us. Because the more we can get, the more we can do. And the more we can do will benefit the country with the needs that they have. So really today is also about reaching out and saying, look, we've started something. Let's keep this wave going and let's do more.
Certainly is, Mr. Sheikh, very well said. Thank you very much for that. And if you are one of those people watching right now and you want to put your questions on how you can get involved more, on perhaps ideas on how what more can be done in Pakistan and how you can all work together, as Mr. Sheikh has been highlighting, please do use the chat box at the bottom of your screen. Just click on it, type in your question. I'll certainly try and come to it once we've heard from our guests. So thank you for now. You mentioned Unilever there, Mr. Sheikh. Let's speak to Unilever because we're very lucky to have the head of human resources in Pakistan with us, Ms. Fathema Zubair. Your company, Mr. Zubair, owns hundreds of brands all around the world with a turnover of billions of dollars. It's a huge multinational firm. And I know Unilever sees the issue of mental health as being a very important one, or it already invests in helping employees. Tell us what exactly it does and how it does it.
Thanks, Asad. Thanks for allowing me to be part of this esteemed panel. I think well-being is something which is already very well entrenched in the tenets of our culture. And I think what we've seen in the last few months is that it is this ownership of well-being which has allowed us to really brave COVID in a very different way. If I really look at our organization today, we are 75% millennial in Pakistan. You know, whether it is employees working from home or employees who have returned to work, everyone has been through some kind of a trauma or the other. Someone is grieving the loss of a loved one. Someone is, you know, looking at a very different family situation, people who have maybe lost jobs in their households. Someone, you know, could be just missing the fun of life, and that's the millennial population that we have. So keeping in mind, you know, the various diverse groups that we have, you know, we right at the outset of COVID, first and foremost, we announced that we are going to protect the lives and the livelihoods of our people, which was a very big stress element, adding to a lot of well-being issues to people. And we said that, look, we're here to provide you whatever assistance we can in terms of protecting lives and livelihoods. Further to that, I think something which became extremely essential, and a lot of the panelists have talked about it, is the fact that stress, depression, anxiety, you know, took a huge toll on our people. What we do have is an employee assistance program, which is a 24/7 line that not only the employees, but even their family members can call into any time of the hour. And we've got trained psychologists on the other side of the panel who, you know, help you with any challenges that maybe you may be going through. And especially during this time of COVID, they have had an extended panel to even handle children issues or family issues for that matter. And I think that's something which has helped us tremendously. Besides this, we have our own trained mental well-being champions within the organization who can really help you know, fellow colleagues in terms of taking care of any of the challenges they may be facing. We've launched a very extensive well-being agenda which says, when do you stop work? You know, when can we basically tell people to take weekend off? And if they are working extensively over the weekend, we give them a free comp off. We made sure that leaves became mandatory so that either it's a staycation or a vacation, but people took some kind of a break. And one more thing that I really want to recognize, I think the pandemic has taken the biggest toll on women. And Unilever is 25% diverse today. We've seen the biggest pullout of the workforce in countries coming out of women, and we didn't want that to happen. Domestic abuse is something that we've seen on the rise. So as a company, we've launched a domestic abuse policy. And I think the only company in Pakistan to do so, which provides protection to anyone who may be going through any kind of challenge as a result of domestic abuse. So very extensive support system, of course, line manager training being extremely key. In this point, we re-looked at people's goals, how can they manage their personal and their professional challenges in a much better way, and a real, kind of a care and a compassionate and a generosity environment coming in from the leadership to make sure that any challenges which are coming up on the people front in terms of mental well-being are being well addressed.
So a lot of work being done there, Ms. Zubair, really leading by example, it has to be said, with your employee assistance program, having psychologists available and your trained champions. What I'm wondering though is, yours is a hugely successful global company. Do you need to be that sort of size or a big, huge company in order to start helping employees and making a difference? What I'm wondering is, if smaller firms, are there lessons smaller firms who are perhaps joining us can take from your example?
So, absolutely. Size doesn't really matter in this case. Yes, it does give you access sometimes to resources, but, look at the way we are talking today to everyone across the world. So one of the positives of COVID has been that the world has become smaller. It's become closer. It's become more accessible. So I think help is at hand. And no company size should really defray them from really taking on the mental well-being agenda. I think it's a big taboo topic in our country. People don't talk about it openly. The first difference that we can make, and they always say that if you want to change the culture of an organization, start changing the conversations. So even start talking about mental well-being issues, being open about it. Leaders and organizations, talking about it, saying that it's okay not to be okay, is a big step in that direction. And I think organizations like ours don't hold these good practices to heart and don't want to share. We are very, very open in terms of our sharing. We want more companies to adopt. And I think platforms like this, just the talk that we are hosting, we are happy to share good practices with any organization. Even at the time of easement, return to work, work from home, Unilever has extensively shared all the policies across the different industries. And I think really it's time we kind of embrace it. So even in our country, you don't have to go to a global EAP app. There are local outfits available that do provide this support 24/7, and happy to assist any organization. Feel free to reach out to us, and we are happy to share our good practices with them and learn from them as well.
Mr. Zubair, that's a really positive message you're sending out all around the world this afternoon. Thank you very much for that, and for the way you've explained what Unilever is doing to help so many of its employees. Thank you very much. Let's just turn to Miss Sanaa Ahmad now, the Mental Health Manager for the British Asian Trust. You have a great overview of this subject. You've been working on it for a few years, really focusing in Pakistan. Tell us what changes there have been this year when it comes to mental health, how it's viewed pre-COVID to now that we're experiencing COVID.
Thank you, Asad. And first of all, I'd just like to, I think this has been recognized with this panel, especially that we have such a diverse range of speakers on the panel today. And that's just a reminder that, it cannot just be the job of mental health professionals to help tackle this mental health crisis. And we really need more diverse stakeholders and key players to come together and collaborate if we're really going to make a difference and an impact. And I think part of the work the British Asian Trust has been doing is trying to form these collaborations and bring people together to have discussions like this. And I think part of the pandemic has made people realize that mental health isn't just, again, an isolated topic, but needs to be included when it comes to, the workplace environment or schools, children being out of school. So educators, more investors, and then obviously the technical experts out there and learning from them of what we can invest on. So Dr. Murad, obviously also mentioned the talk. Mental health has become a hot topic of conversation. There's many positives to that, but again, there's also negatives that can come from that as well. And I think what's happening now and what we're seeing on the ground is a lot of people are struggling collectively. And I think that, when people struggle with something and experience it themselves, they tend to empathize with it more. So their understanding increases. So, I think the uncertainty, loss of this bereavement, loss of lives, loss of jobs, financial strains, parents, because, homeschooling has become a big thing, and parents having to, Fathema rightfully mentioned, mothers having to work from home and, basically go back to school with their children when it comes to online learning. It's been a huge struggle. And I think people are talking about that more and recognizing, so that awareness raising has increased. If you're suffering from something, if you're a mother and you know that you're struggling and you reach out to the next mother and you empathize with her, that support system, what I've been hearing from people as well is that, they're reaching out to people more. So that primary level of care, that support system, I think has increased. However, I think one of the negatives, as Dr. Murad mentioned, is it just a hot topic for this year whilst the pandemic is going on, or is it something that's actually going to be integrated into systems going forward and policy change? We just had a review from WHO come out last week, in which it says 89% of countries have accepted and have said mental health needs to be part of their COVID response, but only 17% of countries have actually put extra funding and allocated an extra budget towards this. So it's just the discussions are great. We need to have more awareness, but we need to also move forward and invest and have at the government level, whether it's schools, whether it's corporates, whether it's the media, all come together, and we need to actually do something about it. I would say, obviously, when it comes to the positive being, again, that with the partners we've been working on the ground, people have pivoted really fast. It was an uncertain time for everyone, but we've realized the need for mental health services. They moved online very fast. They provided digital platforms, helplines. But again, I think that awareness raising is key, because what we found, which was an interesting find through some of our work, is when people reach out, and so we had one of the helplines that we call proactive, and when people were reaching out to people and offering them this help, they really engaged with it well. But when you ask them to seek the help themselves, the number of calls weren't as high. And I think this, again, living in a place like Pakistan, where there's obviously a lot of issues that come up, especially for some of the communities within which we work, which is low and middle income communities. There's such a range of different challenges and issues that mental health isn't often recognized. But we need to show people that livelihoods, financial strains, domestic violence, substance abuse, all these other issues are triggers and can cause mental health issues. So it really, I think Mike mentioned that holistic approach and integrating mental health services within other systems is essential. And I think that's something that, again, has been talked about now during COVID, but it's something for us to learn from and actually, work towards.
Yeah. Okay, Sanaa, I've got one more question for you, but just before I ask it, let me just tell the people who have joined us this afternoon, just remind them that if you've got questions for our panel, do click on the question and answer button underneath, or the chat button, which either is good. Questions have started coming already, and we're very grateful for them. I'll come to them in just a moment. But if you have any questions connected to the subject and what you've heard and any thoughts you might want to share with us, then please do so. Just click on the button below. It's all very easy. As Sanaa was just saying, some of the technology has really helped us this year, and there have been changes. And Sanaa, what I wanted to say was that you mentioned there about the changes we've seen this year, and there have been many because of COVID. You're also very much aware of the programs which the British Asian Trust has been doing until now, and there's been huge success with them. It has to be said, there's no doubt about it. What more of these programs need to be employed in order to tackle the issue now on in going forward, or do these programs have to be tweaked and changed in order to adapt to the new world we're in?
Thanks, Asad. So I think with the bigger picture, and that's what Dr. Murad also mentioned, we've obviously learned a lot. There have been many challenges, that we've seen even prior to COVID when we were working on our mental health program. But especially now, it's become apparent that we need to have, again, more investment coming in, rather than looking at it as just 1 to 2 year programs and projects. When it comes to mental health support, there needs to be ongoing support. You can't provide a service and then, funding finishes and it doesn't exist anymore. That kind of, the impact isn't sustainable, it's not scalable. So we really are looking at programs that we can see and now working towards sustainability and scalability. And as Dr. Murad mentioned, that's very much looking at integrating these services within the healthcare system. And another area that we've recognized is the education system. So, recognizing youth and children and adolescents, looking at preventative care and early interventions, and getting educators and teachers involved, getting doctors and other healthcare professionals involved, again, to create a more sustainable program. Because we do, the negative side is, again, having these COVID responses, having a helpline available, and then when COVID, the lockdown finishes and people stop talking about it and less investment comes in, is that helpline not available anymore for those people who need it? So, the British Asian Trust has recognized an area that not a lot of organizations recognize, which is mental health. And part of our aim and objective is to show investors and to show funders and other diverse stakeholders the benefits and the impact that is being created by investing in mental health. And that's an ongoing struggle, but it's something that we're really have also had great outcomes with people such as CareTech and COSARAF, who've been a role model for a lot of other organizations who are viewing today of, how we can work in mental health, but how that investment in mental health has an overall effect on so many other challenges and issues that we see within Pakistan as well.
Okay, Sanaa, thank you very much for now. We've got these questions really rolling in now, and thank you for those. Please keep them coming. I'm going to try and get through as many of them as possible. I'm going to start with a question here from Dr. Naveed Ahmed, and maybe Dr. Khan, I might start with you here. If others want to join in, please do with any of these questions. But Dr. Khan, I've got a question here from Dr. Naveed Ahmed. Thank you very much for this question. And it says, what could be the small interventions and measures which can be taken within primary healthcare to help those who need support and medical assistance? And he says, in particular with depression and anxiety. As president of the International Association of Suicide Prevention, I decided to come to you first because you perhaps know on a small scale, perhaps amongst family and friends, what small measures can be taken in order to help people going through depression, anxiety, and mental health problems?
Well, the question seems to be quite simple, but the answer is a little complex. But if you wanted to make small changes, then one of the best things you can do is to train the primary healthcare staff in recognizing the symptoms of depression and anxiety, which are commonly known as common mental disorders, which are very common, that present to primary healthcare clinics. So recognizing them, picking up the signs and symptoms, and if they can, you can treat them at your level, but then have a referral system where you can refer them to the mental health services. So common mental disorders, mild to moderate levels of depression and anxiety, if patients can be screened for those, then they can certainly be helped by not having unnecessary investigations or unnecessary medication that have their own complications, which is very, very common in Pakistan.
Okay, thank you for that, Dr. Khan. I'm just going to ask if there's anyone else that wants to come over to small measures which can help people with mental health issues from preventing it from becoming worse. If there's anything any other panelists want to go, otherwise I'm going to move on to the next question, which is from Fiza Yasmin. Good question here. What could be a cost-effective measure to combat the mental health issues in lower income countries with limited resources like no internet services? And that I know will affect many areas in Pakistan, not speaking as a country, but there are many rural areas in Pakistan with no internet resources, where resources are limited, and yet the issue of mental health is as prevalent there as in many other areas. I don't know, Mike or Haroon or Fathema in particular, whether any of you want to come in on this. How can lower income countries tackle this problem? Mike, can I come to you first as a Deputy High Commissioner yourself?
Yeah, sure. I mean, I think the issue that we find most challenging in Pakistan is the volume of need, with a population of 220 million, 60% of which is under the age of 30. Usually people can access a good level of service, but that is not accessible to be scaled up. And I think some of the abilities that NGOs have operated in Pakistan in terms of, if you look at the way the polio vaccination system works in Pakistan, or the way it was pivoted to deal with COVID-19, we need to draw some lessons from that about how, with good training, with good connectivity, you reach those in need. It's particularly challenging in the poorest rural areas, because by and large people can access services in the urban centres, but it does require a lot of funding even to reach people where per patient we're not spending much money. And I think we need to work together, development agencies, government, provincial level, federal level, and particularly those in the voluntary sector, to come up with innovative ways of reaching those individuals. I would just finally say, you are quite right about the fact that connectivity is not ideal when you're trying to reach people in rural areas. But one of the striking things is that how many more people have smartphones in Pakistan now. And I do think there has to be something using the technology. Lots and lots of the private sector organisations are looking at how do we provide digital services now, and COVID-19 has accelerated those plans. We can see that from a retail perspective, so we need to try and grapple with that in a healthcare way. So the digital healthcare solutions are low cost and can be structured in a way that will reach a wide population for not much investment. And I think we would be very interested to see whether we can participate in some of those innovative initiatives.
Yeah.
Mr. Sheikh.
Yeah.
Sorry, Fathema, did you want to?
No, please go ahead.
If Mr. Sheikh, if you could address that first, please, then we'll go to Mr. Berry.
Thank you. I was just going to say, I think just picking up on what Mike said, I think, look, awareness and making people aware of the issues is very important. Whether you're from a low-level income family, high-level income, I think the issues are the same, but being made aware of what are the signs to look for and what are the issues that face you. Because I think there's a danger people feel that I've got an illness, I need medication, I need to go to a clinic or whatever. It's not that. I think it's being made, that campaign of awareness, which is what we started from, making people aware. And I think the British High Commission played a great part in making that awareness campaign start, actually. And thank you for doing that for us. For me, actually, I think what you said, Mike, was very important. In the world of digital, in the world of technology, everybody's got a mobile phone. Mobile apps is the way forward. And I think this campaign could run through mobile apps and everybody could access that. If we're able to send money to remote parts of the world using a mobile app, surely we can make people aware and help them get out of this situation of stress, anxiety, and mental health issues. And I think we need to do more using the technology of a phone, because the phone is really the first thing people go to nowadays. Everybody seems to have a phone, and we can do more through the use of technology.
Mr. Berry.
Yeah, so I think I'll just echo what the other panelists have said and just add a bit to that. So I think Mike mentioned NGOs. There are a huge number of NGOs available, and I think mental well-being is something which can be looked as an area of focus. Secondly, I think there are a lot of philanthropists in our country, and if you really look at it, they are the backbone of providing a lot of support to the areas which require help in Pakistan. And I think we need to dial up that angle in a very big way. And let me not leave us as the corporate citizens, out of this process. While we were just having this conversation, I was thinking we do have a program whereby we reach out to smaller towns through Doctors Online by the name of Doctors, so especially for women. And I was just thinking, how easy is it to add, a mental well-being expert to that line. So I think directing our own CSR efforts from an organization perspective onto mental well-being, we usually focus a lot on the health part of it, but I think seeing the growing concern in this area, that's a big area where corporates could help as well. And
Okay.
technology is there to facilitate.
Okay, and you mentioned technology. Mike and Mr. Sheikh have also mentioned technology. A point made here by somebody called Sanaa Fahim, and thank you for making this point via our chat box at the bottom of your screen. You can also get involved with questions at the bottom, but something that just popped up on the screen now was, you mentioned the importance of smartphones and how it's more prevalent around the world and all the rest of it, but what she says is something that crossed my mind as well. How does digitization work with lower income communities? There's still an assumption there that people have got access to electricity. And I've been to places in Pakistan, Mr. Sheikh, to see the work of the British Asian Trust. And I've been in villages out there where they are working very effectively, where literally there is no electricity at all. So they don't have smartphones which they can recharge. So how do we reach out to those communities, Mr. Sheikh?
So I think it's a very good question, because really it does bring into question accessibility for low-income families. I think, look, I think wellness and well-being, again, if we focus on well-being, we will avoid some of the mental health issues you'd like to think so. But I think from a community perspective, I think certainly we have lots of gatherings, we have lots of places where people meet and talk. And I think we owe it to ourselves to get these communities working better together. Just thinking aloud here, and our masajids, we know they're a wonderful place of getting people together for the purpose of praying. But we can carry a message through when people come to prayers, when they talk about things, because the role of a masjid and a community center was to bring communities together, work with communities. And this message of well-being and issues, wherever you are, you'd like to think people gather in one or two places. And the masjid, for me in Pakistan, having visited Pakistan many times, I know people are very passionate about their religion. And that's a good opportunity actually to engage with them and tell them about these issues that are prevalent. And particularly the young generation, I think we need to also communicate to the young generation the language that they understand as well. And sometimes we miss that trick actually. And I think that young generation, I see there's a lot of issues with mental health that are more prevalent, but we need to deal with that as well. So look, number of forums we can do. I think communities have a responsibility. All of us have a responsibility, but you know, mental health well-being starts at home. And if we can work with communities to build up our home and well-being within the home, you'd like to think these things will be easier to deal with going forward.
Yeah, okay, Mr. Sheikh, thank you for that. Sanaa, I think you want to come in there. Do you want to come in?
I just wanted to add something about this conversation, because I think these have been ongoing conversations about the effect and impact of online support when it comes to mental health. And there's no right or wrong answer, but even prior to COVID, I think one of the solutions, one of the organizations we work with, Sehat Kahani, they go into, areas, low-income areas, and they created e-clinics. So not assuming that, everyone has a smartphone, but they actually created the physical space like an e-clinic where someone comes in, they provide the internet, they provide the online access, they provide, the easy access to a professional. And the beauty of that is that someone sitting, in a rural area or a semi-urban area can have access to a consultant in a city, which they usually can't have. So there are pros and cons to it. I think if we work together and we think of solutions, we will be able to come up with them. But having said that, of course, there are people who, when we talk about domestic violence, a woman sitting at home who has access to her husband or the perpetrator's smartphone might not be able to access that care. And we need to take into account safeguarding as well. So I think there are challenges, but there's also, of course, as Haroon mentioned, many benefits with the outreach we can have by using online methods. So I think it's definitely something that we have to work towards, but also look at the challenges going forward as well.
Thank you for that, I'm going to ask another question now. This one's from, and forgive me if I get the pronunciation wrong, from Igor Wojtasik. and it's a great question, which maybe you all might want to comment on, because I think this is a fascinating one. Where should, he says, where should governments invest the funds for best effect? What solutions would have the greatest impact right now? That really just cuts right to the chase, doesn't it? That doesn't mess about. What solutions are going to have the greatest impact right now? What funds should government be investing in right now? I don't know. Mike, do you want to start off with that, and we'll go around?
Yeah, thank you very much for the question. I mean, I think we would look to work with expert partners on the ground with a sort of blended approach, where we have to have an ability to train the trainers. So we have to have an ability that we can get the message through to those that need it, where they're not going to be able to access a traditional clinic or doctor or nurse. And that might be using a different form of where they do have access to communications, where we may do some campaigns. It may be where we have mobile clinics, as Sanaa was mentioning. I know that those are quite popular in Pakistan. And it may also be people accessing service when they can reach towns and centres. But I don't think necessarily, it's not to say that government is not the best organisation to deliver it. The health system, which is I
think we've maybe lost Mike there. While we hopefully try and reconnect with Mike, Sanaa, did you want to come in on this one? Where should governments invest their funds for best effect, and what solutions would have the greatest impact right now?
So I think I did mention some of this in one of my previous answers, and again, it's integrating into the systems at government schools, at hospitals, improving the quality of care, but also looking at a few longer term solutions. And I think we've had conversations about this. Dr. Murad has also, talked about this, and it's the importance of more training of professionals. Looking at the longer term, we always kind of talk about how we only have 400 psychiatrists in the country, 500 psychologists, and 5 child psychiatrists. And these are stats that have been there for a while. And it's really investing in that, seeing the longer term impact, having more professionals. So as well as increasing the demand side, improving the quality and quantity of the supply side as well, and making people recognize the importance of psychologists, of counselors, of a GP system, the different levels of care. Because what we do find is people like Dr. Murad, who can really give their time to this training of trainers that Mike talked about, to this influencing policy change, and they have such expertise in the field, rather than being overburdened by anybody who reaches out to them who might not need that level of care. So I think it's making the best use of our resources, increasing our primary level of care, working towards prevention, early intervention, and having tertiary care available for those who need it, not just those who can afford it.
Yeah, thanks, Ms. Ahmad. We've got Mr. Nithavrianakis back with us. Sorry, we had to leave you there, Mike. The line froze for a moment. You're making an important point about professionals in answer to the question, where should governments invest invest the funds for best effect? And we were very interested to hear what you were saying.
Thank you. Yes, no, I mean, I think we can go to the next question. It was just to sort of finalise to reinforce the point about making mental health awareness rise up the agenda, so that actually when we look at training, with the UK at the moment, I can tell you, is looking at an initiative on trying to expand the number of nurses that are trained in Pakistan, mainly for the public sector, but it could also be for the private sector as well. We're talking to the Prime Minister's Special Assistant on this, Dr. Faisal Sultan, and I hope that one of the areas, one of the verticals that we might be able to focus on is mental health. And as Sanaa said, the more trained individuals we have, the wider the ecosystem, and therefore the wider benefits to those that need it. But I think it has to happen at all levels, using the voluntary sector as much as the government and the training sector as well. And we would be interested in having a more detailed conversation about that.
Okay, Mike, thanks very much, and thank you for coming back to us on that one. Dr. Khan, Ms. Ahmad also mentioned you in her answer about training and all that. What are your thoughts on governments investing funds for best effect, sir?
Well, I think rather than investing in activities, government should help to organize a national mental health program. an overall strategy for the country would be very important as a first step. And that could have different strands of training, of service delivery, of research, education, and so on. And without that overall overarching program, I think we can certainly do efforts at our own level, but it's not going to have a major impact on the mental health problem that we have in the country. It will not really give the kind of outcomes we are looking for. So a good mental health program at the national level, maybe at the provincial level also, then see what are the things that the NGO sector can do, the charitable sector can do, the governments can do, universities can do, and then divide the work. There's a lot of duplication going on. People don't know what the other people are doing. And whatever one thinks this is important, just pick up and start doing it. And the reason why it's happening is because there's no coordination at the national level. When this pandemic started, more than 30 helplines suddenly sprung up. Individual efforts, but who was behind that? Who was funding them? What was the quality of the service? How well the counselors were trained? What kind of information were they giving out? What were the outcomes? And what has happened to all of them? There was no regulation, there was no coordination. So I think doing this in the way we have been discussing is fine. We can come and meet every year on 10th October and have this World Mental Health Day commemoration. But I think what we really need to do seriously is, because this is a very serious issue, is at a national level, we must have a national mental health strategy. Once we have that, then we can see where we can, which organization and which area can take up which kind of work. We have research. All of these programs that we want to roll out must be informed by local research, not what has worked in the UK, for example. It may not be applicable in Pakistan, but we look at the evidence locally and then try and implement that in an organized manner. That will probably have the best chances of success and the best effect in the long term.
Okay, Dr. Khan, thank you for that. Mr. Zubair, just before we come to you, I just want to slightly change the question for Mr. Sheikh here, because the question is about governments effectively funding in the area of mental health. But you run a couple of charities which do enormous work in this area. And I'm wondering whether, is there much of a joined up approach between the work you're doing and the work government is doing, or could the governments where you work be doing more to help you have more of an impact?
I think you make a very valid point, Asad, because the charities that work outside of Pakistan do find it difficult to engage with Pakistan and the work in charity. When I say engage, I think simple things that you take for granted in terms of facilitating using funds to bring into the country to use for charitable projects, it's a very complex procedure you have to go through. And I think there are very willing charities, I can assure you, outside of Pakistan, that are willing to do more work. But I go out to what Dr. Murad was saying earlier on, is that we need a national strategy. We need engagement at government level, but let's work together. Let's work with the NGOs that are in Pakistan, with the organizations, the charitable organizations wanting to come to Pakistan for the same reason. There's a lot of good people in both sides of the world, whether it's Pakistan or outside of Pakistan. Where there is a need, we can work together to do more. And I think what we need to do is to get this agenda at a government level, because the government needs to make a policy change. And with that policy change, we can drive through this agenda much quicker. Look, the government's doing a fantastic job. It's a large population. There is a budget, there are constraints. But you know, there's only, I don't know, I picked up somewhere, 1% of the health budget goes towards mental health services. Now, we need to get that balance right. The point is this: there are organizations like CareTech, there are many others. We need to join forces and give us the ability to continue to make the change. Because one thing we don't want to do, and Dr. Murad is right, we want to leave something that's sustainable, that the local organizations in Pakistan will embrace and carry it through. We will go in for a period, do our work and come out, then what happens? So we need this sustainable project and mindset to say, look, this is the policy, this is what we're going to do. And then we're going to empower local organizations that are going to run with this going forward. We are facilitators. We've come in, we've started a wave. We want somebody to carry that wave through now.
Okay. And Ms. Zubair, for somebody who's not speaking to us on behalf of a government, who's not speaking to us on behalf of a charity, as a huge multinational organization, what are your thoughts about funding effectively?
So I think all the panelists have spoken about it. There's a lot of work to be done on the awareness and on the base creation side in terms of the support structure that we need to put on for something like this. And really a full plan rather than just shot in the dark in terms of what we want to do for mental well-being. So completely aligned with the thoughts that have been shared with the group. Plenty of work to be done, and really something we should not be just discussing in one day.
Okay, Mr. Berry, thank you. And I know just very finally, Dr. Khan, you wanted to come back on something to do with the budget for mental health in Pakistan. Do you want to just come back very briefly there?
So just wanted to correct Mr. Haroon. There is no separate budget for mental health in Pakistan. 1% budget is for health. And within that health budget, mental health is considered, it is not earmarked. 0.1% is for mental health. That's point number one. Another important point that everyone needs to know is that psychiatry is not taught properly in many medical colleges in Pakistan, and there are more than 100 now. There are very few universities and colleges where psychiatry, mental health is taught to medical students. And only one medical college examines students in psychiatry. Only one, the Aga Khan Medical University. No medical college in Pakistan examines students in psychiatry. The PMDC does not require that. So we have a whole cadre of doctors coming through medical schools with little or no exposure to mental health. And where they come into professional life, that's where they do misdiagnosis and mismanagement of cases. So there are many problems, and we need to really see at these problems. And that is why I re-emphasize a national mental health strategy is absolutely essential.
Okay, Dr. Khan, thank you. And thank you, panel, for answering those questions this afternoon and shedding light on the importance of continuing investment in mental health in Pakistan. What I'm going to do now is hand you back to Richard Hawkes, Chief Executive of the British Asian Trust. Richard.
Thank you so much. First of all, thank you very much to all the panel. I'm sure that everybody else watching would love to have carried on. That conversation was so rich and we covered so many different issues, and I'm extremely grateful to all of you, Haroon, Mike, Fathema, Murad, and my colleague Sanaa for those contributions, for your time today, and for the support that you give the British Asian Trust on an ongoing basis. It's absolutely tremendous. Asad, thank you ever so much to you. Again, you were absolutely fantastic, the ultimate professional, but I think some of us who have the pleasure of knowing you personally know how interested you are in this issue, how supportive you are, both professionally and personally, of the British Asian Trust and of our mental health programme foremost, and we hugely appreciate that. So thank you very much to all of you. Thank you very much to everybody who's been watching today. I know we've got people watching mainly in Pakistan and the UK, but a couple from other countries as well. We're really delighted that you were able to have the time to join us, and I hope you've found it useful and informative. I just finished by just emphasizing what I said at the start and what's come across through that discussion. This is a hugely important issue. Our mental health program in Pakistan is one of our most important programs. We're making a massive difference. It's been tremendous to work in partnership with the CareTech Foundation, with the British Deputy High Commission, and with so many others. But we know we've still got so much further to go. And you've heard that loud and clear through the discussion. There really is a challenge that we need to overcome. There's more work that we need to do, but we can only do that if people keep joining forces with us, they keep coming together with us, supporting us, and perhaps more importantly, having conversations like this. And that's why with World Mental Health Day coming up on Saturday, it's going to be absolutely crucial that more and more people just have these conversations, make it normal to talk about mental health and mental health issues. That will be ultimately the way we get more support and we're able to drive the biggest difference. So I'd just like to say once again, thank you all very much indeed. For everybody who's joined us today, really appreciate your time. Look out for future events from the British Asian Trust. Hope you have a great rest of the day. Thank you very much.
Thank you.
Thanks a lot. Bye-bye.
Bye.